Hi,
Okay.
everyone. Welcome to Hilarity for Charity's month-long initiative to celebrate National Alzheimer's Awareness Month and National Family Caregivers Month. This is our third Facebook Live chat, which is presented by our partners at Home Instead Senior Care. And we've been so lucky to feature some of the most awesome, cool, and leading Alzheimer's advocates. Before we get going today, I just want to remind everyone that Alzheimer's currently affects close to 6 million Americans today and is projected to cost our country $1.1 trillion annually by 2050. That is crazy, and that is why we are doing the work we are today to change these very terrible and scary statistics. So, for the past 2 weeks, we've had the opportunity to speak with two social change makers so far, Ai-jen Poo and Tony Hawk, and we're so excited to keep it going today with our very special guest, Maria Shriver. Many of you know her, of course, as a journalist, as an NBC News anchor, and the former First Lady of California. But Maria has been an amazing, brave leader in the world of Alzheimer's advocacy for years. I admire her greatly. I feel so lucky to have gotten to know her. And I'm going to start by asking her a few questions to kick us off, but then we want to hear from you guys. So be sure to type in your questions anytime, and we will get to them as we move through this. So, hi, Maria.
Hi, Lauren. Let me just say that thank you for having me, and back at you for being such a brave, fearless advocate yourself. And I'm so glad that we're friends. I'm so glad that we're in this together. And I get great inspiration from you. So that's why I'm here.
Well, it's just a love fest.
Yes, it's a love fest. That's good. I love that. It's a perfect week to be having a love fest, right?
It is.
We're so blessed. So many others aren't, right? And especially here in California, where we've had all these incredible fires, but so many people, as you mentioned, caregivers in this month, kind of working around the clock to care for somebody with Alzheimer's. It's really such, kind of backbreaking work, but talk about love. Talk about love work. I always say it's the most, if you want to know what love looks like or love is, go watch someone caring for someone with Alzheimer's. So I'm really glad to be kicking off my favorite week of the year with you.
Yes. So we'll start with, honestly, if you could just share your history, share why you got involved in this fighting for this disease. Why has this disease, how has it affected your family? Just if you could tell us your story.
Sure. Well, my story with Alzheimer's, we all have multiple stories, right? So my story with Alzheimer's started in 2003 when my father, Sergeant Shriver, was diagnosed with Alzheimer's. And I knew very little about the disease. I had no idea what it would how it would manifest. And so I started asking doctors about it, realized that there was very little information out there for the general public. So I wrote a children's book called What's Happening to Grandpa, because I think when Alzheimer's impacts someone you love, it really impacts the whole family. And so even though you're 40 or 50, you're a child of Alzheimer's. So you're trying to process what actually is happening to my dad, my grandfather, my grandmother, my loved one. So I started kind of tiptoeing into that space. And then I tried to make that into a film. And then I tried to kind of get other people to bring it to, kind of the larger public at large. And then I finally, after 2 or 3 years, convinced HBO to do a big Alzheimer's project. So I did that. One of the hours on that was on my children's book, and then have proceeded to kind of advocate in this space. I did the big Shriver report because I noticed that more and more women were being impacted by Alzheimer's. And when I went around to doctors, they said, no, that's not true, or it's only because women live long. Then for the first time that women were disproportionately impacted. And then we established the Women's Alzheimer's Movement really to fund research and try to understand what was going on in women's brains that's different from men. What could we learn? Women also 2/3 of all the caregivers, how could we support them? So it's really been this, whatever that is, 14 or whatever years of advocacy, of trying to instigate, agitate, push the public, talk about what people were actually going through, those numbers that you threw out at the beginning. They're big numbers, and I don't think sometimes people can kind of wrap their head around what's happening in 2050. But what's happening today is that people are going bankrupt from Alzheimer's. What's happening today is that people's lives are being changed. Every 65 seconds, a new brain develops Alzheimer's. 2/3 of them are women. So as we have this conversation, families are being impacted all across this country. And that's what's happening today. So I'm trying to talk about prevention as you are. I'm trying to reach young people and say, this is your disease. This is your generation's disease. You can do things today that will impact your brain for tomorrow. I'm trying to talk to people of my age to say, get your house in order. Understand that this can impact your home in a multitude of ways. So I see myself really as as a messenger. I'm trying to be a messenger of hope. I'm trying to be a messenger of information, an advocate, but also a bit of a prodder and a pusher to doctors and to women in general. Like, get on this bandwagon, get informed, and then push your doctor to take care of you or your loved one in the proper way.
Yeah. Wow. That's amazing. You're amazing.
Oh,
I mean,
yeah.
there's so much going on. Can we just sort of, let's talk about women really quickly and just dive into that. Can you give us some of those statistics about how it does affect, what is it,
Two-thirds of all the cases, yes, are women. And the women's Alzheimer's movement is really trying to fund research into that very question, the why of that. Why is that happening? What can we do? What kind of research can we fund? What is different in women's brains? And if you think of Alzheimer's being 20 years in your brain and women being diagnosed, let's say in their late 60s or 70s, what's going on 20 years before that in a woman's body, in a woman's brain? Well, guess what? It's perimenopause, it's menopause, it's postmenopause. So we're trying to talk about hormones. We're trying to talk about that time in a woman's life. What's happening, not just in her body, but what's happening in her brain. And when I talk to women about, well, you're right to feel different because something is changing in your brain. It's a sense of like, I'm not crazy. Okay, help me understand. And doctors have not been educated really in women's health the same way as they are in men's health. So often women find it very frustrating when they go to their primary doctor and say, like, can you help me? Should I be on hormones? Should I not? I'm feeling a little foggy. I can't remember this. Do I have Alzheimer's? Do I not? They find their primary doctor isn't often their best partner in this. And so we're trying to really push doctors to also be educated, to be women's best partners and educate women what they need to know about their own blood tests, their own health, how they can keep themselves working at an optimal level, because this does impact women differently than men. And it does impact women who don't have Alzheimer's in their family. That's one of the big myths. People think, oh, well, it doesn't run in my family, so I don't have to be worried. That's wrong. And it's also wrong to think that, oh, it runs in my family, so I'm definitely going to get it. That's also wrong. So there's a lot of power here that we all have individually to not, actually say, oh, I'm definitely not going to get Alzheimer's, but to protect yourself as best you can.
Right. So on that note, I know you and I both sort of are trying to live these sort of brain healthy lifestyles, and we, are sort of talking to some doctors who are leading the way in prevention. And it's, leading a brain healthy lifestyle, it's hard. So much of it is diet and exercise. I know for myself, I've recently really tried to cut out sugar, which is so hard when I love food.
Me too. That's been my downfall.
What are some of the things that you do to lead a brain healthy lifestyle?
Well, I think, I guess really what I'm saying also a lot of the time is I wish I knew at your age what I know now. And that's one of the big things I'm trying to stress to women in their 30s, their 40s, even my girls in their 20s, right? That sleep is certainly really important. Trying to learn how to meditate. I started really late in life meditating, because that's a time when your brain can slow down, can clear itself, as is sleep. Food. the impact of sugar, as you said, on the brain. I, grew up sugar. I have turned to sugar. I don't really drink or take drugs. So sugar is my drug, and it is a drug. And so we know that that's really bad for your brain. And so I advocate getting off the sugar. But if you see me eating sugar, I kind of out myself because I'm, not 100% where I'd like to be. But exercise, certainly really important, high intensity training. So it's kind of our American lifestyle, trying to move as much as possible. A sedentary lifestyle is not good for the brain. So I think what's good for the heart is good for the brain, right? So I think when people say, what is a brain healthy lifestyle? It's those things that I talked about. It's trying to decrease stress as much as you possibly can. Stress, we know, is not good for the brain, and easier said than done. I know women are saying, I'm getting up at 5 o'clock. I'm, the provider. I'm making snacks. I'm raising my kids. I'm having 2 jobs. I'm working all night. I'm taking care of my parents. Easy for you to say, Maria, to decrease stress. I'm like, I've been there. I get it. I know. But I think the whole, discussion about caring for yourself, so you can care for others, is a really good conversation for women to have. And I know that I've often put myself last, and I don't think that's good. And so I think the sooner you can put yourself in the center of your own life, this is something that caregivers struggle with round the clock. I met a woman last week who told me she has a special needs child who's in her late 30s. And she said, I'm working 24/7 and have been for 30 plus years. And this is the youngest of my 4 children. So there are so many people in that space. So how do they care for themselves? How do they slow themselves down? I think, trying to prioritize your health is something I think is a good message for all of us. And I think then what are the about how should I be on hormones and menopausal history? Being an informed individual, I think, is, and then understanding that you do have power to control your life.
Yeah.
So I try to do all of those things. I meditated a little bit this morning. I'm trying to go to bed earlier. I'm trying to eat healthier. Get toxic people out of my space.
That's amazing. I'm having an internet problem. I'm moving.
You're moving. That's good for your brain.
I'm moving.
You're multitasking, which is not good for your brain. I'm getting a tour. Is that your house?
This is my house. My internet wasn't working. I'm going to move just because that wasn't working there. We'll try it here. We'll see what happens. So hopefully everyone can hear me and I'm not frozen. But we just got a question from Lori, and she says she'd read a study about women who had been on anxiety and depression medicine long-term and that they were at a higher risk for Alzheimer's. True or false? I have not heard that. I don't know if that's something you'd come across in your work.
Well, there's definitely a correlation between depression and Alzheimer's.
Yes.
I don't know about that particular study she's discussing, but there haven't been long-term studies on people who have been on antidepressants for a long term. That's something she should talk to her doctor about, bring in that particular study. But for many people, and women in general, who are twice as likely to be depressed, antidepressants are a lifesaver. For many of those people, there are many people looking at alternative forms to antidepressants that are herbal related and also lifestyle related. But I think that that's something that she should talk to her specific.
Yeah, for sure. I agree. And I think that, especially.
But one of the things I should say that helps with. Can you hear me, Lauren?
I'm having a little trouble hearing.
Okay, I think antidepressant doctor, that she is right to know that there is a correlation, a higher correlation between people who have depression and Alzheimer's, but she shouldn't panic about that. She should talk to her primary physician. But one of the things that we do know that helps is exercise, is social engagement. That's another big thing when we talked about prevention, isolation, loneliness.
Yeah.
Struggling with depression, obviously pick that up with your doctor. You know, try to get out there, try to build a community, try to get into a community, try to exercise, because that does help with depression.
Yes, very much. And I will say, you know, as someone who's been caring for my mom, supporting my dad as he cares for my mom for the past 12 years, and have struggled myself with anxiety and depression due to these extreme circumstances, that it is so important to pay attention to how you're feeling and to work toward acknowledging those feelings and finding a way to balance this unbelievable hardship that it can surround taking care of someone with Alzheimer's, but also in living a life and taking care of yourself. And I think that's hugely important for our brain health.
Yeah, exactly.
Yeah. All right, we're getting a little glitchy, so I'm going to move to our next question, which is basically, as an advocate, what in your mind can people be doing to show their support for National Alzheimer's Awareness Month? If someone wants to be an advocate, what's something they could do today even, or you know, over the next month, if they wanted to take a small step or two small steps?
I think you said, how can, the question was, it's a little choppy.
Oh,
But I think the question was, how can someone be an advocate? And
yes.
I think the best way to be an advocate is first be an advocate for yourself. Advocate for your own health.
Yes.
Then tell another person, say, look, you know, I'm about healthy brain lifestyle. I want to raise they can who has a loved one, they can go in and spell them so that person can appointment, go to their own gym, take a walk around the block. There are all kinds of things we can do to serve our fellow man or woman who's in the caregiving trenches. I wrote this week in my Sunday paper about an inner Peace Corps, about trying to come together as a country to be of service to our fellow man and our fellow woman. And there's so many things, you know, we talk about kids going to be babysitters. What about, you know, young people or people of all ages coming and say, look, I know you're caring for someone with Alzheimer's. Let me come in and do that job for you today, so you can go to the mall and go shopping, or you can go get a manicure or a pedicure, or you can go and just let the sun sit on your face and cry, or whatever it is you need to do. So I think that's a great thing to try to figure out what we can do another. That's how you can be an advocate and you can get into this movement.
Yeah. Those are amazing ideas. I think sharing your story.
And I think the other big thing, Lauren, is to vote for political people who want to fund research into Alzheimer's, who want to put caregiving policies in place, who want to build cities for the future, who are advocates of healthy aging and a caring, conscious society. I spoke to the nation's mayors a week ago here in Los Angeles, where they gathered, and asked them and challenged them to join us in creating healthy cities for the future. Ask them to, you know, advocate to bring Alzheimer's stakeholders together, hold summits, talk about it in their state of the city, put together an Alzheimer's czar, make sure that their first responders are educated about what Alzheimer's is and isn't. So there's a lot that people can do with their vote, with their pocketbook, with their own voluntarism. Yeah.
Yes, very well said. Thank you to all that. There's so much good information in this, and we've recorded this. This will live on our Facebook page, hopefully without any glitches that I've seen here. Maria, first, thank you so much for your time and for all of your hard work. You are a true inspiration for me and for Hilarity for Charity, and we're honored to work alongside you guys. If anyone has you know, times are tough, but if anyone has any extra dollars lying around, you can donate to the Women's Alzheimer's Movement. You can donate to us at Hilarity for Charity. We will be back again on December 28th with George Bradenberg, who is the chair of Us Against Alzheimer's. We will talk more about legislating for more Alzheimer's funding through the government with George. And don't forget to share your Alzheimer's story using the hashtag Many Faces of Alzheimer's. And starts with that. Share your story, take care of yourself, know your family history, take some time to meditate, take some time to exercise. And this is not a good week for this message, but if you can, maybe watch your diet.
Yeah. And I think, you know, have hope. Look, it's really important to be hopeful. I like to think that you and myself included are cultivators of hope. And I think, you know, people think, oh, I don't want to get involved with Alzheimer's. It's hopeless. It's depressing. It's like, let's get hopeful. Let's get inspired. Let's, you know, kind of challenge ourselves. This is the Mount Everest of diseases, and we can scale this baby. So come on, let's go.
I love that energy. We will be the hope cheerleaders. I always say I feel like there's so much hope where I didn't feel there was many years ago. So I feel really energized. So thank you for your time and energy, and thank you to all of you for joining us. And share your story, and we will talk to you next week. Happy Thanksgiving.
Happy Thanksgiving. Happy Thanksgiving.
Thankful for you and everyone.
You too. Back at you. Bye.